As healthcare professionals, we often find ourselves at the forefront of human suffering. Our training frequently emphasizes symptom management, addressing immediate concerns like destructive behaviors or suicidal ideation. While crucial, this approach can sometimes obscure the deeper landscape of a patient's experience. We must strive to move beyond merely treating symptoms to truly understanding the root causes of despair and helplessness. This requires a profound shift in perspective, looking beyond the presenting problem to the underlying pain. It means recognizing that what we observe is often a manifestation of unresolved trauma. It is vital to explore our patients' lives, their aspirations and their motivations. Understanding their unique journey allows us to connect with their inherent strengths and resilience. This holistic view fosters a more compassionate and effective healing environment. We must also critically examine our own professional actions and interactions. It is essential to consider whether our interventions, however well-intentioned, might inadvertently replicate past traumatic experiences for our patients. Building trust requires careful self-awareness and sensitivity. Ultimately, much of human suffering is deeply intertwined with experiences of love and loss. Our role as therapists and healers is to help individuals acknowledge and bear the weight of their reality. This process, though challenging, is fundamental to genuine healing and integration. Trauma can profoundly alter an individual's relationship with safety and freedom. Many traumatized individuals may remain stuck in familiar patterns of fear, even when opportunities for liberation are present. This phenomenon is often described as learned helplessness, a profound sense of powerlessness. The body's natural fight, flight, or freeze response becomes dysregulated in the aftermath of trauma. This dysregulation can lead to extreme pain or agitation, as the nervous system remains on high alert. Everyday situations can trigger intense physiological reactions. Individuals who have experienced trauma often secrete excessive stress hormones, such as cortisol and adrenaline. These hormones persist in the body long after the immediate danger has passed. This chronic elevation contributes to a state of constant physiological arousal. There can also be a powerful, often unconscious compulsion to repeat traumatic patterns. Individuals may seek refuge in what is familiar, even if those patterns are frightening or destructive. This reenactment can feel paradoxically comforting due to its predictability. This reenactment is not merely a repetition, but an unconscious attempt to gain control over past traumatic situations. The individual may be trying to master what was once overwhelming. It is a desperate, albeit often ineffective, strategy for resolution. Activities that were once uncomfortable or even painful can, over time, become enjoyable due to the body's adjustment and chemical balance. This can lead to addiction-like cycles, where the familiar discomfort becomes a strange form of solace. The brain adapts to the stress. When these activities are unavailable, individuals may experience withdrawal symptoms, similar to those seen in substance addiction. This craving and subsequent preoccupation with pain can dominate their thoughts and behaviors. It reinforces the cycle of distress. The body secretes endorphins during periods of intense stress or pain. These natural opioids can contribute to the development of addictions and may also serve to block or numb physical and emotional pain. This biochemical response can inadvertently reinforce maladaptive coping mechanisms. At the core of trauma's neurological impact is the amygdala, the brain's threat detection center. In traumatized individuals, the amygdala becomes hyperactive, constantly scanning for danger even in safe environments. This heightened vigilance is exhausting and debilitating. The sensitivity of the amygdala is closely linked to serotonin levels in the brain. Low levels of serotonin can contribute to this hyperreactivity, making individuals more prone to anxiety and fear responses. This biochemical imbalance perpetuates a state of alarm. Consequently, traumatized individuals often experience compromised social coping abilities. Their hyperreactivity makes it difficult to engage in healthy social interactions. Trust is eroded, and connection becomes challenging. Medications, such as Prozac or fluoxetine, work by increasing brain serotonin levels. This can help to address the amygdala's hyperreactivity, reducing anxiety and improving mood. For some, these medications offer a crucial pathway to stabilization. However, a purely drug-centric approach carries significant limitations. While medications can suppress symptoms, they may not address the underlying issues of trauma. They can create a sense of false calm without fostering true integration or healing. Similarly, the brain disease model of mental illness, while offering some insights, can inadvertently disempower patients. By solely focusing on biological deficits, it may shift attention away from the holistic healing process. It risks overlooking the profound impact of lived experience. Central to restoring well-being and fostering healing is the re-establishment of healthy relationships and community. Trauma often isolates individuals, and reconnection is a powerful antidote. Safe, supportive bonds provide a foundation for recovery. Language plays a crucial role in processing traumatic experiences. Communicating one's story, finding words for unspeakable events, helps to organize and integrate the past. It allows individuals to find meaning and narrative in their suffering. Individuals can learn to regulate involuntary bodily functions through various practices. Activities like conscious breathing, mindful movement, and therapeutic touch can help to calm the nervous system. These somatic approaches empower individuals to regain control over their physiological responses. Creating safe environments is paramount for healing. This involves changing social conditions to foster spaces where individuals feel secure and supported. A sense of physical and emotional safety is a prerequisite for vulnerability and growth. Flashbacks are a hallmark of trauma, characterized by vivid re-experiencing of past events. During a flashback, specific brain regions become highly active, particularly the limbic system, which processes emotions, and the visual cortex. The past feels terrifyingly present. Interestingly, during flashbacks, the Broca's area, which is crucial for speech production, often shows decreased activation. This neurological phenomenon helps explain why individuals struggle to articulate their experiences during these intense moments. Words simply fail them. The brain processes information differently across its hemispheres. The left brain is typically responsible for logical thought, facts, and sequential processing. It helps us make sense of events in a linear fashion. In contrast, the right brain processes emotions, sensory details, and non-verbal memories. It holds the raw, unfiltered experience of trauma. This hemisphere is more involved in the felt sense of an event. The deactivation of the left hemisphere during traumatic recall hinders the ability to organize experiences logically. It also impairs the capacity to translate overwhelming feelings into coherent words. This disconnect makes it incredibly difficult to narrate or process the trauma consciously. Chronic elevation of stress hormones, such as adrenaline and cortisol, is a persistent consequence of trauma. This sustained physiological arousal leads to a cascade of physical and psychological symptoms. Sleep problems, irritability, and chronic pain are common manifestations. Some individuals may consciously deny or suppress their traumatic experiences. However, the body registers the threat regardless of conscious awareness. This internal conflict leads to a chronic stress response, which can manifest as various physical illnesses. The profound truth is that the body remembers even when the mind attempts to forget or suppress. Traumatic memories are stored not just in the brain, but in the very cells and tissues of the body. This somatic memory demands our attention and respect in the healing process.